I was accepted onto the drug trial. I have no idea if it is going to have some sort of beneficial effect on my condition, whether it's slowing it up or not. But that's not the point that I did it. I did it because I feel if I can be useful in some way to this program, I find that meaningful under the circumstances.
It's all in our hands, this life of time that's given to us all. It gathers round each night, each morn. We watch it pass and grow. It is all in our hands, it is all in our hands.
Our mission is to make the UK the go-to place to conduct early phase trials in dementia. The UK has fantastic research expertise, but it is under-resourced and it is patchy. And the UK, relative to other countries, in spite of that expertise, has underperformed in clinical trials. The government recognised this and said, we will fund the development of a network.
The UKDTN was funded by close on 50 million of funding in 2024 to really demonstrate our commitment in this area.
The funding there is really to capitalise on the excellence in the UK in terms of its early phase trials, the really experimental, innovative trials. And that's where the UKDTN is really providing huge value.
There were essential building blocks that needed to be a part of it. The first was patience.
The patient work stream within the UKDTN aims to give people who have not previously had an opportunity to participate in research the opportunity to do so, to improve support for people not just during but before, during and after research participation, and thirdly to improve the experience of people participating in research.
We are building this network to answer the issues industry had with clinical trials in the UK.
The UK can be quite tricky to navigate from an industry perspective, so the DTN really offers that one front door for us to step through. So it's really about connecting the right trials to the right sites and ultimately the right patients.
We started working with UK sites almost 4 or 5 years ago, and we see, for example, that the timeline from when we first contact the site to when the site can be activated are already significantly shortened.
There are 3 pillars within the workforce and training work stream: capability, capacity and community. Capability is about building that expertise right across the disciplines that is fit for purpose so we can deliver early phase trials. Capacity, because we recognise that there is a real gap at the moment in terms of critical mass of people who are trained in the delivery of early phase dementia trials. And the third thing is that we want to develop a community or a network across the UK, which means that we are trial ready.
Finally, the network, which is crucial to all of this. We started with 3 pilot sites and 1 trial. We then brought on a further 5 sites, so we now have 8 full member sites. In addition to those, we have 22 affiliate sites who are working with us to develop the expertise required to become a full member site. This network enables us to accelerate and harmonise conduct, and it's already paying dividends with multiple trials in setup.
I think it's such an exciting time in this space. There is so much research coming through.
Sounds like I'm overstating it, but I don't think I am. This could change the world if we have a viable treatment for dementia, but that's only going to happen if we have this confluence of researchers, funding and participants.
This is a really exciting time for dementia research. We are seeing breakthroughs in blood-based biomarkers and digital biomarkers for diagnosis of the disease, but we're also seeing a raft of emerging therapeutic options. We think that the UKDTN is really well poised to capitalise on taking these from the bench to the bedside and getting these emerging treatments out to patients.
By working with sites all over the UK, we can all play our part in changing the future for people living with dementia.
So I'm not just hopeful, I have expectation that we will have treatments that make a bigger and better difference.
I'm quite sort of proud of the fact that I'm participating in these trials.
I think it's a brilliant initiative, I really do. I think it's hugely hopeful.
It is all in our hands, it is all in our hands. This life of time.